Bonjour, Marie. Merci beaucoup for joining me for a Corona conversation. Can I start just by asking you to introduce yourself and to say what you do for a job and where you are?
Yes, hello, Adam. Thanks to inviting me to speak about the French situation. So my name is Marie Jauffret-Roustide. I'm a sociologist and I'm working at the French National Institute of Health and Medical Research in Paris.
So perfectly positioned to tell us a little bit about what's going on in France. And today is April the 19th, 2020.
Yeah. 2020. No, the 19th, 2020, yes.
Yeah, and really whether it's the 16th or the 21st, it doesn't matter. Does it matter if it's a Monday, Tuesday, Wednesday? Now every day is... Anyway. So France has been hit fairly hard in Europe, not quite Italy, not quite Spain, but maybe similar to the UK. Can I start by asking what has been the impact of COVID-19 on people who drink and take drugs?
So it's quite difficult to answer very precisely to your question now because we have very, very few research results until now. So my discourse will be more based on impressions and informal discussions that I have with community-based organization or harm reduction professionals or people who use drugs. So what I can say, because as you say just before, there are two different populations. You have population who take drugs for pleasure, and we have very, very few informations about this population because we have few studies and few professionals who are in contact with people who only take drugs for pleasure. And as you know, in France, drug use is illegal, and that's more difficult compared to other countries who have legalized cannabis, for example, who are more tolerant for cannabis use compared to France. That's more difficult for people who use drugs in France to speak freely about their use. Use is repressive policy. But what we know until now about the situation is the fact that the dealers, as usual, have developed some strategies to adapt with coronavirus, and the situation is very different. If you compare, for example, Paris, a large big city with more rural areas or smaller cities. So in Paris, people who use drugs can still have access to drugs and especially to cannabis. And the dealers have changed their habits. For example, you have more and more people who sell drugs and who deliver at home, like for food, for example. That's very interesting because the changes in our practices that we have had with food, for example, in Paris, more and more people who had the habits before to go shopping outside have now delivery at home for food. And that's also the case for drugs. You have more and more people who smoke cannabis, for example, who don't go outside to buy the drug and who are at home and wait for having somebody to deliver it at home.
Is it not more risky for the dealers to do this? Because I understand that in Paris, for example, the police can stop you and you have to have a reason for why you are leaving the house, and maybe it's more likely that you will get stopped by the police?
We don't have any data on it, but if in France, we are totally locked down, and if we want to go outside, we need to have an attestation, a paper, when we write where we are going, and you can write that you are, and we are only allowed to go outside for 1 hour for walking, for example. for doing sports outside.
And for cannabis delivery.
No, but no, and for shopping. But for shopping.
Oh, for drugs.
Yeah.
Drugs is shopping.
But what you can write on the paper, you can, for example, write on the paper that you would go shop for food, and or that you will go outside for doing sports, and you can make a stop and go inside a building and to sell your product.
Okay. Has there been any problem with a reduction in availability or purity of other drugs, maybe like cocaine or ecstasy, or you don't know about this yet?
Yes, but what I was talking about was about the situation for Paris and large cities. But what we know is also that in smaller cities, for example, or in more rural area, that's more difficult for people to obtain drugs. And what we also know from ethnographic informal observations that have been made, for example, by the French EMCDDA, the French focal point of EMCDDA, OFDT, is also that you have some people who use drugs for cannabis, for cocaine, or for heroin, who decided to make stocks at home as for food. So that's why for me it's interesting is to see that people who use drugs and people who use drugs and who have incomes who are in middle or rich class have had the opportunity to make stocks like we do, like some French people did it for food. So
and
you
wine.
can,
and wine as well.
And wine as well. But regarding wine, we have a lot of studies that are been doing now, and what we can see is that for certain part of people, you have an increase of drinking alcohol. And especially for people who are very anxious, for example, as you know, in this period of time, a lot of people are anxious. So drinking alcohol or smoking drug is also a way to be relaxed. And that's also something important for people who are very anxious. But in general, we don't observe until now an increase in the level of alcohol in general, because people have less opportunities to have dinner with friends, for example, or to go outside in restaurants. So if you make the mean between the different way of drinking alcohol, we until now, we don't observe a very big increase, only an increase in certain population who have problematic drug use or problematic alcohol use, or people who are very anxious. But as we have very less opportunity to make parties or to be with friends, the level of alcohol is not very important. What is interesting at the opposite is that we observe a very, very big increase with people with games with money games.
Gambling.
Yeah, gambling. And we have very, very recent data that shows that there is an increase with gambling online, for example. But regarding the availability of drugs, obviously it has decreased. Some people have made stocks. The dealers have adapted their strategy. And to be very honest, regarding the presence of the police is not all over the city. It's, for example, I'm totally locked down, so I didn't go outside from 5 weeks. So that's very difficult for me to say to you what happened outside, because I'm in my house. But when I watch some documentaries in television, and I do a lot of semi-directive interviews with harm reduction professionals, and they told me that the people who are arrested are more people who are living in very precarious conditions. So when you are from a middle or rich class, and if you are in the street, and if you want to buy cannabis, I don't think that it's more difficult compared to before.
So it's the same as always. People who have money and a house and look nice, they get away with it. If you have a disadvantage, you are vulnerable, you are homeless, now nothing has changed. Maybe it's even worse. So can I now move to people who use drugs in a problematic fashion? So injecting populations, homeless populations, what's been the impact on them, and what's the government done to make things safer for people in treatment?
No, what you just said is very interesting, because I think that, as always, pandemics and this large epidemic is increasing social and health inequalities among people. So for people who have problematic drug use, the situation is worse compared to before. And we can say that probably at the beginning of the pandemic, people who use drugs were people who were totally forgotten from the government, because our government decided to do a lot of things for vulnerable people regarding COVID-19, in terms of people who are old, people who are chronic disease, but they totally forgot to do something for people who are in problematic drug use. So that's why we have in France a federation, a large organization called Fédération Addiction Federation, and they make a lot of advocacy and they ask for having the mean to protect themselves as harm reduction professionals or professionals who work in drug treatment, and to have also the means to protect people who use drugs when they come in harm reduction facilities or in drug treatment centers. And at the beginning of the pandemic, nothing was planned. So that's why the solutions came from the ground and not from the government.
As always.
As always. And they had a very important success in doing this advocacy, especially for the opioid substitutive treatment. Because in France, as you probably know, we have a very high level of people who are under opioid substitutive treatment, probably the highest level in the world. We have 85% of people who inject drugs who are on opioid substitutive treatment in France.
That's
85%.
amazing.
Yes.
And most of this is buprenorphine?
At the beginning, that was for the majority buprenorphine, but they try to have a better balance now. So the majority is still on buprenorphine, but we have more and more people who are on methadone too. And the access to methadone and buprenorphine is quite easy in France, because you can get it from a general practitioner. And what the Fédération Addiction ask with other organizations is to allow people to have their prescription for a longer period of time. And now people can go in a pharmacy with an old prescription and to have the opioid substitution for 3 months with a prescription that was
the person has 3 months of medication to take?
No. They don't have 3 months of medication, but when they have a prescription for 28 days, that is an old prescription that was just done before the lockdown. They can use it each month again.
So they don't have to see the doctor, but they can get a month's worth of medication.
Yeah, but they don't get their treatment for 3 months. So that's a major measures that have been taken by the government, and the other measures that have been taken. So that's a national measure, and you have also regional measures. So in France, you have the Ministry of Health who decide to implement some measure at the harm reduction measure at the national level, but you have also measure at the regional level. At the regional level, which are taken by regional health agency. And in Ile-de-France, in Paris, for example, the regional health agency was very, very reactive, and they decided to allow professionals who work in drug treatment centers or harm reduction professionals to have a lot of equipments regarding COVID-19, especially surgery mask and hydroalcoholic gel, because at the national level, there were a very important lack of these tools. And so now in some region, drug treatment centers and harm reduction facilities have a good of equipment, and they can host people to come, people who use drugs to come in their centers. So what is organized now in terms of harm reduction facility and the drug treatment center, there is no collective welcoming. So people are coming in center one by one. And so all the places were open all the day for people to have a rest or to wash their clothes. It's not allowed now to avoid contact with people. But what is done is for drug treatment center, you have more and more video consultation with the medical doctor or psychologist and people who use drugs. And in harm reduction facilities, the delivery of safe equipment is continuing, but in a different way, one by one. And for example, we have in France 2 injecting rooms, drug consumption rooms. And in the drug consumption room, people are still allowed to come, but the number of people who attend the room has decreased a lot for 2 reasons. The first reason is that the professionals need to avoid contact, so they are not allowed to welcome a lot of people. And you have also, and that's also very interesting trend, people who use drugs and who had a problematic relation with drugs, who decided to use this moment to stop and to make a break. Like, for example, dry January. So that's comparable to prison. So all the surveys that have been done, and especially qualitative and sociological surveys that have been done on prison, for example, show that some people who have a problematic drug use, when they are when they are in jail, some of them will have access to opioid substitutive treatment, but some other take this time to have a different relationship with drug, and some of them will make a break. But to be honest, that's not possible for everybody. So you have some people, but I think that we will document that in a survey that we will begin very soon. But until now, we have only some ethnographic and informal observation. And it seems that for a minority of people, they decided to try to make a break with crack, with heroin, for example. What we can also observe is that you have some drug treatment centers who welcome a new population of people who use drugs, and a population that they never saw before. And as the availability for opioid substitutive treatment in France is very high, the drug treatment center accept now to have more and more people some people who were using heroin and cocaine, for example, and they don't have the availability, and that's more difficult for them to get the drugs, because that's more difficult to find the dealers, that's more difficult to be in public space and to wait for dealers. That's why for some of them, it will be an opportunity to enter in a drug treatment program. So that's also probably a quite good consequence, because this pandemic will allow some people who use drugs to have a new contact with drug treatment centers, harm reduction professionals, and
although you started late, France was starting from such a good baseline of engagement and penetration of people who use drugs problematically that you were able to ramp things up very quickly. So it sounds like, you know, it's been a very positive public health response. The final thing, oh, sorry.
No, but yes, it is a positive public health response, because we have in France a lot of teams who have a lot of teams in harm reduction, in drug treatment centers, who are very strongly engaged in advocacy and people who want to take care of people who use drugs. And there is a lot of solidarity between all these professionals who are well organized. And as we have before this strong harm reduction policy, that's why the response is probably better compared to other countries. But I don't want to be misunderstood. The situation for people who use drugs, and especially for people who have a problematic drug use, is not so good, because they don't have, but because that's very difficult for poor people, for example, because before they were begging, and the way they got money were from begging for a large part of them, and they don't have this possibility. So they have difficulties to have access to food, to have access to housing, and they are in the street. And something which is also very, very important is that the pandemic increased the stigmatization of people who use drugs and of people who are poor, because as the totality of the French population is locked down, all people are in their house. And when in the street, you have the neighbors, you have some people who are in their house, and when they saw people who use drugs and who are poor in the streets, they stigmatized them, and they called the police, and they told to the police they don't have to be in the street, because they are danger for us, because they can spread
be a
coronavirus.
Public health response, but
Yeah.
the population's response has actually increased the distance between us.
Exactly.
Exactly. Thank you for clarifying. It was really important. The final question, Marie, I want to ask you is, how do you think drug treatment and drug policy will change in the future as a result of the experiences we have now with COVID?
That's difficult to answer to your question now. We will implement in probably next week or the week after a large qualitative and sociological survey in France about this topic and about the professional change and the institutional change in harm reduction due to the COVID, in harm reduction practices due to the pandemic. So that's quite difficult for me to understand, to answer to your question very precisely now. But what I can see when I discuss with harm reduction professionals, and what I can say is that the pandemic, as all crises, is also a time for truth, and a time when you can see people how they are, and that's why what we can say at this period of time is this strong engagement of people from harm reduction professional and drug treatment center professional. They are so involved, and that this pandemic is probably a time when more and more solidarity between teams, for example, will increase for the future. That's probably one of the major points. The solidarity. The second point is a reflexivity. I don't know if it's a good word for
reactivity, the responsiveness.
No, not the fact that people, the harm reduction professional and drug treatment professional, in this period of time, in this crisis, they are not. They have the opportunity to think about their own practices.
To reflect on the things they do. Sorry. Yeah.
The self-reflection on their practices. And I discussed with harm reduction professionals during focus groups, and what they told to me is the fact that as they are confronted to a crisis, they need to think about their practices and how to improve these practices. For example, in residential centers, there is a sort of open-mindedness regarding the opportunity for people to use alcohol, for example, in a harm reduction manner in residential centers. Because before, in residential centers, all drug use was totally forbidden. But with the lockdown, it's difficult for people to be totally closed in their home and not to be able to go outside and to see friends. And that's why, as you know, alcohol or cannabis has also a way to be more relaxed. And that's why in residential centers, in some residential centers, for example, some professionals are more open-minded that the use of drugs in a harm reduction manner will be allowed, and it was not the case before. So probably one of the lesson of this crisis is the fact that drug treatment centers who were totally focused on abstinence and very reluctant to implement harm reduction practices in their center can see how drug use is also something anthropological, that people need to be happy, and that drug use is not only linked to suffering, and that they also need to change their practices and to be more open-minded and to accept, for example, some drug use who might be regulated by people, and not to say drug use is a bad thing, so you don't have to use drugs. So that can be also something positive that will emerge from this crisis.
That's really interesting. So more tolerance and an acceptance that there can be functional drug use without very high levels of harm. Yeah. And that if you help people understand how to use drugs in a less problematic fashion, it's good for everybody, you know?
Yeah, of course.
Interesting. Marie, thank you so much. I mean, it's fascinating, and particularly because I think you describe things in France that we haven't heard from other countries. And this is how important culture and who we are as a nation makes our response so different. So, merci beaucoup. Yeah, and stay safe. And maybe in a few months, when this time is a little less crazy, it would be really good to find out some more information based on the work that you'll be doing. So until then, au revoir.
With pleasure. Thank you.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah. No longer focused on yesterday, and I don't care, the rest will say whatever they want, what's left to say. what's left to say.